Now, fáilte rash, go Ireland I am. On a hold, agus tá mé lots of terror, so even better reach. Now, tons of animals are referred to the veterinary specialist clinic each day for surgery, and as you can see over our shoulders, one is taking place right now.
Right now, as we speak. This could only be done by the hospital's team of Supervets who work tirelessly throughout the day. Leading the charge here is Dr. Laura Cuddy, and not only are you co-owner, co-founder here at the clinic, Dr. Laura, you're also a surgeon yourself. Tell us what's going on just over our shoulder here.
Yeah, so in this theatre here we have Dr. Shane Gearan, one of our surgery specialists, and he's doing what's called a bilateral elbow arthroscopy or keyhole surgery for elbow disease in a young dog.
Okay, and would keyhole surgery be common for dogs, Laura?
It's very common, unfortunately, and that's largely breed dependent and partially due to how patients have been bred, and that we see a lot of younger patients with problems with arthritis that need arthroscopy early in life. So this patient is less than a year of age.
Right, and that's due to the breeding, you would say?
Yeah, partially breeding and partially development.
And how to tell us what this procedure involves then?
Yeah, so it's quite technical. So we have obviously a 4K, what we call tower. It involves putting a very, very small diameter scope, so a 1.9mm scope, into the elbow joint, and that magnifies the joint hugely so we can see the cartilage and clean up any bone fragments or cartilage damage that we see inside the joint.
Is it pretty bad? Is he bad inside?
Listen, this fella's doing all right. He'll be fine. We'll get him up and running.
What's the outcome? What are you hoping for this morning?
Well, the goal today is to improve what we have in cartilage health. We can't replace cartilage as such. You have to go for actual joint replacement to do that. But we should be able to improve his quality of life and offer him a good, long-term, good quality of life.
So we've been here all morning, Laura, and we've seen, we've done echocardiograms, we've seen the exotic pets, and now we're seeing surgery. How many surgeries would you carry out a day here?
Anywhere from 6 to 10 specialist surgeries, so these are quite time-intensive surgeries, either from a knee surgery to an arthroscopy to a spinal surgery to emergency abdominal surgery, so a huge variety of surgery.
The whole hospital here is a huge operation. We've met so many members of the team, the staff here this morning. You actually co-founded the hospital a couple of years ago. Tell us about that journey.
Yeah, so my husband and I founded this hospital about 4 years ago now. We were like an episode of Grand Designs. We had some kids in the meantime. Essentially how that came about is we both, after we finished vet school, went to the States for further training. So most of our specialists here have undergone at least 5 years of additional training and examinations to become specialists. So we did that in the States and saw how different veterinary medicine was there at the time, 10 years ago, and really wanted to bring that back to Ireland and say, well, if Pets in America have this high-tech treatment and technology and really wonderful people, that's what we want here.
And there's nothing like that here. There was nothing like that here before, right?
No, there's very little in the way of referral for small animals, and so it's been, the Irish public have been very receptive and wanting more care for their pets as well.
So you perform surgeries, but you also teach and give workshops. So a lot of people come here to train, is that right?
That's right. So we have a lot of interns here from different countries. So at the moment we have 12 interns. They come on a yearly program to learn with our specialists. We also have a residency training program where we teach surgeons essentially how to become surgeons. And then we also have a lot of visiting students, and a lot of our staff go and give lectures to vets all around the world.
God, it really does feel like Grey's Anatomy, doesn't it? The interns and everything.
We want to talk about blood donations. Very important because there is a lack of blood donations, right?
Yeah, it's really important. A lot of people actually don't even think that dogs and cats can donate blood. And it's a super important thing for us because many of our patients are critically ill and really in need of blood. And so we always put out calls for blood, and we have a bank of blood donors that we call on when we need them. Many people are concerned about blood donation, what that means for their pet, but in fact many of our own pets are blood donors, and that's how comfortable we are with it, that we're happy for our pets to donate.
Different blood types as well, right?
There are. Dogs have a couple of different blood types, and cats as well, and some are very rare blood types just like in people, and those are very, very precious to us. Particularly some cats have extremely rare blood types, and they are kept as a really special one when we need them.
Okay, I know we met your dog Dickie earlier. He was in the hydrotherapy earlier, and he donates blood.
He does.
Is it difficult to get them to sit still for that amount of time?
No, usually most of them we do a trial first and see how they feel about it. If they're in any way uncomfortable, we don't proceed with the donation. So they always come and meet everybody and see how they feel. If they need a small bit of sedation to make them comfortable, we do, but many of them don't, and with treats and a bit of support, they're usually quite happy to donate.
Before we wrap up, how long is this surgery expected to last?
Usually about a 45-minute procedure from start to finish, but there's a whole host of things that go around that as regards getting them ready for surgery, recovering from surgery, but the surgery time is about 45 minutes.
And obviously hygiene is a major cause for concern.
Well, that's why we're like this.
Yes,
okay,
super important, and that's why we're not going past this door. Hygiene for what we do, there's no tolerance for any mistakes, and so hygiene is super important for us.
We met a dog earlier, Pippin, who have been in under for a 4-hour surgery yesterday.
That's right.
So some of the surgeries are really intense and really long.
Yeah, Pippin had a chest and an abdominal surgery yesterday. Is doing very well today, but a really, really difficult anaesthetic and a really difficult surgery. And we can't do that without a super team of people and really, really high standard.
Oh, you're doing incredible stuff here, Laura. You really are. So are you calling for donations for blood?
If anyone has a dog, usually we say a dog over 25 kilos, 1 to 8 years of age, who is otherwise healthy, not on medications and has not travelled, they can contact our team, info@vetspecialist.ie, and they will get in touch with them and see if they're a good donor. But with any donors we can get, they're always welcome. Blood is always necessary. Just like in people, we always need blood.
Just as we wrap up, we're going to bring in Dr. Bobby here as well this morning. Bobby, we've been on a proper journey here this morning, haven't we?
It definitely is, and I think it's nice to show kind of what goes on behind the scenes. I think when you bring your pets in to be treated.
Yeah. Now, before we let you go, first of all, thank you so much, and to all your team here behind the scenes. It's an incredible facility. You do amazing work. We want to pay tribute to one very special member of staff here this morning, who's been with us, in fact, for 20 years.
Imagine.
He's as old as the show itself, but he doesn't look it. Derek Cullinan, we're going to bring in Derek here. Derek is our flow manager. Come in here, look. And Derek is a very valued member of staff. I mean, you've been through the highs, the lows, and we really, really enjoy your guidance and all the hard work.
Derek Cohorticus, you deserve this. Cohorticus, fittingly. Well done.
Thirsty work here this morning.
Well done, Derek. Congratulations.
Thank you very much.
Oh, great stuff. Right, amazing morning here at Veterinary Specialist Ireland. Back to you in studio, guys.
I don't
You know, concept doctor. Doctor Derek.
He's not impressed. Poor old Derek's not impressed. Oh, Derek Ella, that is.
All right, coming up.